Welcome to Dogtors Without Borders, a podcast from the Michigan State University College of Veterinary Medicine. I'm your host, Kristen Lair. Today we'll have a conversation with two members of our anesthesia service in our veterinary medical center, Dr. Chris Thibault and Dr. Sara Taylor. Welcome to the program.
Thank you.
Thank you.
Well, I'll get us started off. I would like to know how you each became interested in becoming a veterinarian.
Becoming a veterinarian is something I've wanted to do my whole life. And so I kind of knew that right away from the beginning.
Great.
For me, I was in high school, I think probably a sophomore, and my mother was going on a work conference to San Diego. And in the process of that conference, one of the activities that they had for everybody was to visit the San Diego Zoo. And I loved visiting that place. It was very special. And the whole time I was there after I left, I just thought I need to work here in someplace like that. And that's how my whole path got started.
Now, you both work in our service of anesthesia. Tell me a little bit about what that means as far as being in a specialty service within the hospital.
For me, I think being in a specialty service, we're in a large teaching facility. We have specialties of every kind available in veterinary medicine. And so one of those aspects is anesthesia. And so we're just an integral part kind of in the middle of all those services. So we don't see specific patients and clients. Our patients and clients are the other doctors within this building. And we work with them to make sure that their cases have the best anesthetic and analgesic and pain control options as possible. And then our other client would be our referring DVMs that call us with questions about different aspects of things that they're dealing with in their own practices.
And did you know that you could specialize in a service like this when you were a vet student?
I did not. I didn't realize what an anesthesiologist was until I was in vet school. And going through vet school, I took multiple elective rounds of anesthesia because I loved it so much. And one of the anesthesiologists, just a few weeks before I graduated vet school, was like, you should think about an anesthesia residency. And so Dr. Thibault was actually a resident when I was a vet student here. And so I didn't really pay attention to what that meant until that mentor initiated that conversation.
I knew, obviously, my passion of getting into veterinary medicine was centered around zoological and exotic medicine. So I knew about specialties. Anesthesia was something that I fell into. As I was finishing my internship, there were very few opportunities at that time for zoo and exotic internships and residencies. And a former mentor of mine had mentioned that MSU needed an anesthesia resident, and you should look into that. And so I did a little bit of due diligence and was pretty much told, yeah, if you want to come do this, come do a residency. So a year later, after graduating from MSU, I turned around and drove another 2,000 miles back from Tucson, Arizona, and I've been here ever since.
What were you doing in Arizona?
Well, I graduated from MSU in 2014, and in that process, I was selecting internships, and the internship that I chose first and selected me was a private practice called Valley Animal Hospital in Tucson, Arizona. They were a very busy 24/7 practice that saw dogs, cats, and then everything exotic. So lizards and birds and a number of other things. And then we were also at the Reed Park Zoo 2 days a week. And that passion of zoo med is what pushed me there. And then after that is when I found out about this anesthesia residency option. And as I was considering that, my mentor there, I told her about it, and she looked at me and she told me, you'd be stupid if you didn't take that position. And so that is how I ended up in anesthesia from the zoo and exotic side.
Yeah, I did an internship prior to doing my anesthesia residency. Through vet school, I was like, equine only sports medicine. That's exactly what I'm going to do. Until my mentor put that bug in my ear about doing an anesthesia residency. So I went on and did an equine rotating internship at a practice here in Michigan, where I did a lot of equine anesthesia, and then I really fell in love with it and said I have to come back for a residency. So I applied back here, and the rest of the story was written.
Very nice. One of the things that I remember as I was finishing my residency, I spent a few weeks with some human anesthesia departments at a few different hospitals around the state. And multiple times a day, I would always get asked, well, how do you intubate a dog, or how do you intubate a horse? And to be quite honest, it's easier, in my opinion, than intubating people. And I've been around enough people that have been intubated in those situations and see what they do. There are more similarities between what we do as veterinary anesthesiologists and what medical human anesthesiologists are doing than there are differences. There are differences, but there's a lot of similarities. A lot of the medications we're using are the same, or at least same types of medications. We're using all of the same general anesthetic equipment and monitors and everything else that goes into that process. We do specialized nerve blocks the same that they do and different things like that. So there's a lot of overlap of how we operate in that regards. What are some of your passions, Sara, about anesthesia? What are the things that you enjoy about the work that we get to do?
So the thing I love about anesthesia is to be able to teach students and to aspire future anesthesiologists. Also with anesthesia, it's such a team sport, I would say, in general, because like you touched base on earlier, Chris, is that it's a team effort from the hospital. We have our primary doctors that bring their cases to us. We anesthetize them, and then we transfer those cases back to those primary doctors. So it truly is a team effort, and that's what I love about it too. It's the challenges that each individual case presents, and it's amazing to be able to help these animals and do what we do.
Yeah, you mentioned the teaching aspect, which is unique for us because we are at a teaching institution, which is not your only option when you specialize in something. You can specialize and go into a number of different careers, and I think that's half of what we get to do here is we get to teach the students. And I think my aspect of teaching students is they have to understand, and they do, that how important anesthesia is as part of their careers and dealing with their patients. But they're also nervous when they come to anesthesia, or when they're doing their first anesthetic cases, when they're in their groups doing their first spays and neuters, and they have to run anesthesia for the first time. I remember my group mates in that situation being very nervous. I don't remember being particularly nervous about that, but I remember everybody else being particularly nervous about that. And then when my goal with our students and our rotations when they're coming through the hospital is just to get them to understand that we've given them the knowledge of what they need to do, and they just need to start using that knowledge and just make them feel comfortable and at ease, and just give them that encouragement that they can do it. But we're still right there with them just to help them through those little hard parts for them. And after 3 weeks of those students being with us, and you can finally see them just kind of relax and they understand what they're doing, and you can see their confidence grow from that first day to that last day, that's what's fun for me about the teaching aspect of what we do.
It is pretty amazing to see them as first-year veterinary students, and then how they grow and see them on the clinic floor and how far they've come. That's definitely a rewarding part of the job.
Yeah. But again, people don't have to go into teaching. We've had other residents that don't go necessarily into the teaching world, and, they can work in private practice, in a hospital, anywhere. Right now, most people don't realize that the number of veterinary anesthesiologists is a pretty small number. We're a small, tight-knit group. And there are job postings all over the world for what we do in most countries, at most teaching institutions, at most veterinary hospitals that specialize in referral practices anywhere. So we get emails all the time from the anesthesia college talking about the job postings that are out there. And so there's a lot of opportunities for people that want to do more. And I'm just happy whenever we get a student that's like, this was really fun and I want to do more of that. And you get to tell them all the little things that are great about anesthesia. For me personally, I do belong in anesthesia, even though I transitioned from the zoo world, but I don't deal with money. And as much as I enjoyed my time talking with clients, I just focus on the patients that come through, and I have very little paperwork. And so that's perfect for my personality type.
Like Dr. Thibault was saying, we get job openings maybe 1 to 5 daily. And so I think a big part of what I do is I try to inspire the next generation of anesthesiologists just because it's needed. And so I can say from when I started here as a resident, and then even now, I can see an increasing number of students that are interested in this specialty.
We obviously enjoy the work that we do. We spend a lot of time trying to be as good as we can at it. And I like it when we can interest other people into it. I'm always realistic with people on the realities of what it is that we do. Medicine is never a 9-to-5 job, regardless of what you're doing in that process. Now, when you take on surgery and anesthesia and emergency, now you're looking at 24/7, 365 days a year of work that needs to be done. And so that can be challenging for some people, especially if you've already been doing it for 10, 15, 20 years. When you get that phone call at 3:00 in the morning, sometimes those just really start to add up on you over time and it can burn you out. So I always try to be realistic with people and just try to explain to them, this is the type of life that we have. It's fun. We do a lot of good work, but there are hard aspects and there's a little bit of sacrifice of your personal time that comes into it when you want to do things like this. But that's when the exciting stuff happens. That's when we see really good cases, cases that challenge us. And when you have a case that's regardless of what it is, and it's, that animal is suffering for whatever reason, for whatever they're going through, and they're in a really tough surgery, and your monitors are blaring and alarms are going off and their blood pressure is terrible, but you start to fix those things and start to bring them back from that, and then you get them recovered and out of that process, and you get to see them walk out of here. Like that's a pretty special feeling.
That's an amazing feeling.
It's an amazing feeling. And we are not at the forefront with the clients. So we're back there doing a lot of the hard work with our other colleagues, but you have to also be a little bit humbled by the fact that you're not going to get all the thank you letters and the little gifts that people come and are appreciative of. And I'm fine with that, but it is a little bit different in that regards. So
kind of like the silent hero. So what's your favorite thing to anesthetize?
That's a hard question for me. Usually they ask me the things that I have anesthetized, and I tell them the list is short of things I haven't anesthetized just because of all the time I've spent at the zoos. I think one of the things that I'm most proud of that we get to do is the number of giraffe that we've anesthetized with our zoo partners at Binder Park Zoo in Battle Creek. I think in the past few years, and you've been a part of several of them, we've done maybe 7 full anesthetics on giraffe. So anytime we work on those large species, that's always fun. My happy place is at the zoo. Much like your happy place is anything around the horses, my happy place is when we're at the zoo. So the species variety is the best part of the job, in my opinion. So
I think that was one of the things that brought me back to a career in anesthesia, was to have that species variety as well. Yes, I'm passionate about horses and I love to anesthetize horses, but definitely being able to work on a giraffe or a rhino every now and then is pretty cool too.
Why would anesthetizing a giraffe be a challenge?
So this is a very large animal, very tall animal. You may not realize it, but they're very dangerous to work with in regards of if they get spooked, they kick and they can lash out, and that can severely injure and or kill people. So it's a very stressful period when you're doing that. Anesthesia in a species like that is challenging because you can't just gently restrain them, give them pre-medication drugs to help them, relax and make this anesthetic process smooth. So they're usually out of their routine. So these animals are all on a routine in zoos. They're in their holding spaces. They get let out in the morning. They get to go wander out in the day. They get fed periodically, like they know what's going on. So the moment they kind of get pushed into a different space than they're used to, then they're already aware of what's going on. And so when we work with those zoo veterinarians, they have to calculate a dart of anesthetic drugs, very potent drugs, and they dart those animals, usually kind of in their upper leg muscles. And then you have to watch that animal start feeling their drugs, and hopefully they sit down appropriately, but they can fall over. And so when you're dealing with an animal as tall as a giraffe is, you have to make sure that the spacing is well padded, that they're not going to be slamming into walls or fencing and things. So there's a lot of environmental factors you have to consider with those species. Once they're kind of down on the ground, then that's when we go in, and Dr. Taylor's been there when we've done that. We go right in and we get IV drugs in them right away. We start putting catheters in them. And once we get that situated, then the rest of the team comes in. We get their airway secured. Our zoo partners love working with us because we can handle the anesthesia aspect for them so they can focus on everything else that they need to do. And we never give a drug without letting them know what's going on or what we're doing. We're very good communicators in that regard, but it's a challenge when you're dealing with an animal that big, and their physiology can be different compared to what most people are used to. And so we just work through that and keep them ventilated and keep them breathing and keep them asleep so that we can get done what needs to get done. It's safe for them. And then we get out of there and reverse their drugs, and then they pop right back up a few minutes later. So we've been very successful with the draft work that we've done.
One thing I'll add is you have to make sure you massage their necks. They really need their necks and their head as a pendulum to stand up. And then you can even go as far as pumping their legs to try to make sure that perfusion stays adequate throughout.
Any large animal like that's down, you have to try to make sure that you keep things moving as much as you can and keep those procedures as short as possible, because their muscles are the only, if we injure their muscles or something happens to their muscle tissue and they can't stand back up again, then they're probably not going to stand back up again. So it's important that there's literally are people just assigned to each leg, and every so often they're pumping and moving it, and there's people holding up the neck, and they're bringing out Theraguns and massaging muscles and stuff like that. So yeah.
What would you say a day in anesthesia is like?
Well, here a day in anesthesia is we get our students started in the morning by discussing a topic that we've already pre-planned out for the day, depending on where they're at in the rotation, that we need to review with them and just make sure that they're up to date on. And then we start getting our cases together for that day. So the other services have already started talking to us about what patients they have and what procedures they need to do. And then we start planning the best anesthetic care that we can for those patients. And the other important aspect that we advocate for is analgesia. We are specialists in the American College of Veterinary Anesthesia and Analgesia, and so we always sometimes have to remind people about the best anesthetic care that we can do for their patients, which everyone is always open towards, and that's just, we specialize in that aspect of things, and so we tend to put that at the forefront. So once we get those cases going, in terms with our nurses and our students, then our day just kind of gets rolling, and we just constantly modify and change our plans as they go, because you just never know what's going to come into the hospital on any given day. We could have state police in here with their dogs getting exams. We could have a number of emergency cases, the fun intestinal foreign bodies that the clients bring in, or someone's dog may have been hit by a car and we need to deal with that right away. So there's a number of things that could come in that change our day, and we just constantly modify our plans and go along. As an anesthesiologist, we are not as much touching the patients anymore as we are when we are residents and students, but we are managing 6, 8, 10, 12 things all at the same time and keeping tabs on things and problem solving, not just issues that pop up with patients, but issues that pop up with equipment and other things. So, and then if everything's going well, we might be finishing up around 5 or later. Our days can go very long sometimes.
Yeah, I will say on the large animal side of things that at any moment a colic can walk through the door. And so here we have to do small animal, large animal, and then we might have exotics that walk through the door as well. So really having that species variety is also one of the perks of the job too as well. And so we don't just do small animal, we do large animal too.
Can you tell our listeners, what does analgesia mean?
Analgesia just refers to pain control. So that is what analgesia is, anesthesia and analgesia. Anesthesia essentially is just the process that essentially the brain can no longer perceive pain. That's what happens when you're anesthetized. All the other things that can cause pain, bleeding, all those things when you get cut or poked with something, all those things are still happening locally, but the brain can't perceive that. But when you wake up from a procedure, then you are feeling it. And so that's where the analgesia and the pain control aspect comes into play, is trying to control that pain as much as possible. So that's what analgesia means, is just pain control.
So what is the most unusual case you've ever anesthetized?
In the hospital or out of the hospital?
Let's do in the hospital
In the
first.
hospital.
Yeah, so a guinea pig for radiographs, and it was a very short procedure, but that was the most unique one that I've definitely had to anesthetize.
Why was it unique? What did you have to do different?
They're so tiny. And so the things with that is sometimes guinea pigs are like to hide snacks in their cheeks. So you got to like flesh out their mouths. And then what adds extra difficulty to it is that their airways are so tiny. And so that's what makes it so unique. It's just how tiny they are.
I mean, we've worked on a lot of tiny patients and a lot of really big patients. One of the surgeons years ago, early in my residency, had a pet rat that he wanted to neuter. And so he brought it into us and we anesthetized it so he can neuter it real quick. And just like Sara said, they're rats even a little bit small. Well, at least rats here, not New York City rats, but a rat here is at least a little bit smaller than a guinea pig. So we have to, the phrase that we use that a lot of people use is MacGyver. We had to just create a little face mask to be able to anesthetize this rat with. And so we used gas anesthetics, and then we used a little face mask and got him asleep, gave him some analgesic meds, and did the procedure and woke him right back up again. So there's little things like that. We've worked on some really interesting cardiac patients before, just a number of different procedures that we've done. I'm trying to think anything specific.
I think uniqueness-wise depends on the species and the type of case that we anesthetize. It's not necessarily just a guinea pig for radiographs. It's the type of physiology, too, that we're up against. So to me, uniqueness might even just be a dog, but it depends on the disease process that's going on with that dog.
Yeah. I know we've had animals that have been victims of gunshots come through, and we have to quickly stabilize them. And so that usually involves, obviously, our emergency department, which is amazing, our surgeons, and us. And so all three groups of us are working together to stabilize these patients in different ways and communicating with each other to get them through these procedures. That's a big collaborative aspect of what we do. We've had, obviously, the zoos have brought their patients into us. We've done MRIs on lions and tigers before. We've had a giant Galapagos tortoise come in for a CT scan before. He didn't have to be anesthetized. He had some sedation on board, but he was just a logistical problem of fitting him and getting him into the hospital and then moving him to the CT. But yeah, we get involved in those things. The variety is massive. There isn't one thing that specifically sticks out to me.
I would agree with that because, again, it's just the disease process that you're up against and the anesthesia challenges. Like a dog that's going in 3rd degree AV block that goes into ventricular tachycardia, so really, really low heart rate, and then goes into a really, really high heart rate. And so to me, that's what uniqueness is when I think about anesthesia, not necessarily the species. It's the challenges that they present.
So you really have to be fully aware of everything else, every other system that's happening with your patients when you're considering anesthesia and analgesia.
Yes.
Absolutely.
Anesthesiologists have to be mini specialists in all the specialties for the most part in order to understand what's going on. When we need more detailed information, I know where to find it, or I find one of my colleagues in that specialty for extra assistance. But for the most part, we kind of mini specialize in all aspects of physiology. We really do have to understand how to anesthetize everything that's not a human being.
That's why I like to say it's a team sport, because we do consult all the time with each other and other specialists. And that's part of the beauty of the job too, is taking that team effort and providing the best care we can for our patients.
Tell me about the communications between the front end, meaning the anesthesia service, and behind the curtain, meaning the surgeon or the veterinarian performing a procedure.
There's a couple aspects to the team way of how we operate that I could tell you about. First is just the service in itself is we have usually one of our nurses, we call them the case coordinator for the day, and they're the point person that everyone in the hospital is coming to, and to start asking the questions of, we have this, can we do this, can we fit this in? And so then we're working with that case coordinator to rebalance and massage the schedule out so we can get all these patients taken care of. Obviously, everything urgent and emergent takes priority over things that are not urgent procedures or not electives. And then you get into the OR situation. And so you were talking about us at the front, or the head of the animal, and the surgeons kind of in the back. We usually refer to that as the blood-brain barrier. So we're kind of like the brain of the operation, and we kind of let the surgeons kind of do everything else in the back there. That's one of our funny aspects that we talk about. But there's constant communication there. If I'm having a problem ventilating a patient, or their oxygenation numbers are low or blood pressure is low, I'm constantly informing the surgeon, this is what I'm dealing with. You know, are you having bleeding that we don't know about someplace? How is this patient responding to what you're doing? Do I need to adjust my drugs based on what you're doing is causing an issue here? And so there's a constant amount of communication going back and forth. And that's really good. Sometimes they're listening too hard because they listen to a conversation that we have with each other or with our student right there talking about potential problems. And then they think that is a problem. We just tell them, hey, just go back to cutting. You're doing fine. Go ahead, you know. But otherwise, it's constant communication with everyone that we're working with. We don't work in a bubble, and it's a balance.
Before the patient even gets to us, you know, the student goes and talks to the client, gets the history. The primary doctors go talk to the clients, get even more history and medical pre-existing diseases and all that stuff. And then by the time the patient gets to us, we've had a thorough rounding on it. And so it definitely is a group effort from start to finish. And then when that patient goes into recovery, we're rounding the primary doctor again and all other specialists that need to be involved about all of our happenings that happen during the anesthetic event. So it really is a group effort, especially if that patient's very critical. Then we have to pull extra specialists into the case as well. So yeah, that's the beauty of it.
How do you factor in the total anesthesia time versus just the surgery time or procedure time?
So there's this thing called surgeon time. You know, they think, all right, this is going to take me 45 minutes to do this. It always takes them longer. They have no concept of what time is. But regardless of what the time is that it takes a procedure, we have work that we have to do beforehand and work that we have to do after. How I describe it to the students is doing anesthesia is like preparing to fly a plane. You have to do a lot of prep work before that plane can take off the ground. And then you get it off the ground, which would be inducing anesthesia. You hit a few bumps along the way, but then you have to prepare to come out of anesthesia again and get that patient recovered. So it could easily take us, you know, if surgery is only an hour long, it could easily be 2 hours of total time or more that we're involved from beginning to end, from getting that patient to making sure that they're fully recovered and stable, that we can walk away.
And I think beyond that, again, it goes back to that patient walking through the door, right? And getting your physical exam pre-op. And then it goes beyond that, it goes days after anesthesia follow-up on that patient too. Just because we transfer it back to the primary service doesn't mean we don't keep tabs on that patient. We like to follow them through their hospital stay too. And sometimes those patients have to come back to us for various procedures or another procedure or what have you. Sometimes we have to anesthetize them 5, 6, 7 times. So I really like to follow, or all of us like to really follow their hospital stay and see how they progress. I would keep updated on them as well. So that way, if they come back to us, we know what we're up against.
What's a non-medical skill you didn't know you needed before working in this field?
Basic math is one thing that we do all day long, every day, because you have to calculate doses and concentrations of drugs all the time. And if you haven't been doing that routinely, and I'm not saying our students can't do basic math because they all can, but when you haven't done it routinely and you know exactly the common places you're going to make math mistakes, that's a big deal. A decimal place error can severely hurt a patient. And so we've all made math errors, but that we also have processes in place where I give this to somebody else. Even if I've done the math myself, one of my nurses looks at it, they're going to double check the math too to make sure it works. Or if they do the math, I'm going to double check them, same thing. So I think basic math I consider that a non-technical skill. A lot of that medicine is art, but that's a non-technical important skill that comes into play every day with our students.
What I would say is a huge learning curve is not just managing one case or 2 cases at a time or 3 cases when you're a vet student. It's the 10, the 15. And then even beyond the case management, it's again, it goes back to the type of case that you're managing. And that's where an awesome team effort comes into play. We have really, really good nurses. They do amazing work. And so it's amazing what we do. And so they allow my job to be easy, and that boils down to be able to teach the students some excellent anesthesia and analgesia. So going back to your question, I think a big one is being able to read the animals. So like equine, and I know I'm always going back to horses, but horsemanship. Just basic horsemanship when you're sedating that horse or handling that horse from recovery goes a long ways to be able to read what that animal is trying to tell you. So I think along the lines of being able to read each species.
That was definitely something I had to teach myself before my anesthesia residency. I had literally ridden a horse once in my entire life. I've still only ridden a horse once in my entire life, but I've anesthetized hundreds of horses by this point. So I had to teach myself how to read horse behavior very acutely and understand what's happening. So, and that's part of any species. And that's an art form. It's hard to teach that. That's experience and time and making mistakes and figuring them out as you go along. So
I will say work-life balance. So when I was introduced into the field of veterinary medicine, it was work 24/7 nonstop until the job was done. And I can say over years, and I started shadowing out in private practice, more on the large animal side of things. But over the years, even now, I can see the work-life balance shift as in it's well-rounded. And that boils down even to the students' work-life balance being on clinicals too. And so there's a lot of things that have been implemented to make it healthier.
Part of those were out of necessity. When I was a resident, I definitely had some long holiday weekends. I can remember a few Thanksgiving weekends where I was literally the only anesthesia person on call for both hospitals for 4 days. And some of those included 36 long hour shifts of being here, jumping back and forth between hospitals with people waiting in between, and my faculty having to come in and just take over for a few hours so I could take a nap, that type of thing. So we've worked really hard to improve that aspect within our group. Some of the work-life balances in veterinary medicine in general were forced upon us just because of how stressful COVID turned into this. There were no students in the building, and there was a increased amount of work and caseload, and not just at all levels, people were getting severely overwhelmed. And so I think a lot of people started asking the question, how can we make this better for people? Like the way that medicine had been operating historically kind of got broken during that time period of extreme stress and pressures and caseload. And so we've done a lot of work, I think, within ourselves and within the professions just to kind of improve that as much as we can. Medically speaking, I think I've seen different drugs come on the market over the past, I've been out of school 11 years now. And going back even before then, I remember the private practice I worked at in high school when they first started using propofol, which is a very common anesthetic agent that we all get, people get, animals get, but it was new in the veterinary market at that point. Funny fact is it was actually discovered by a veterinarian. So I'll put that out there. So the different drugs that we've used, the type of equipment that we have available to us now, incorporating ultrasound guided nerve blocks, the feature-laden anesthetic monitors that we have now, and the very smart ventilatory systems that we have now to help keep our patients asleep, and the assistance that gives us. There's a lot of features. A lot of these things have been in the human medicine market for a long time, but these are now kind of affordable enough to kind of hit the veterinary market. And now we have a lot of this equipment. And so our students see that equipment, and then they know what type of medicine that they can do when they leave here. So that's kind of how I've seen it evolve over time.
I think also along the research side of things and literature, we just have more information of how things work in different species. And again, different equipment that we're able to use on a daily basis. So that helps us provide even better care to our patients and also teach our students and our residents.
Tell me about the peacock.
So our peacock is a unique species that we don't really anesthetize every day. We do avians and birds all the time, I would say. But the peacock is unique as in it presents kind of its own challenges. So you have the long train, the feathers. So it's not just cosmetic things that you have to watch out for. It's also like the long neck. Essentially, the peacock was like a routine avian. It wasn't anything that we weren't used to anesthetizing, I will say. It's just with the peacock in general, it's that really long neck, so you have to make sure it stays nice and straight. It's not going to impede its airway, and then you have to really make sure those long feathers and that train, cosmetically, that you have those kind of out of your surgical site and things like that.
Yeah, I mean, birds are obviously very different physiologically from most mammals that we deal with on a daily basis, but I also don't think they're overly difficult to work on. Once you have a little bit of experience, they're actually very easy to intubate if you need to secure their airway. It's just that they ventilate, they breathe a little bit differently. Their musculature is a little bit differently. Drugs work on them differently. And so we just have to kind of modify what we do on a normal basis and understanding how those things work on them. But yeah, I remember that peacock, but we've had a few other ones in over the years. And a variety of other birds. I can't tell you how many different eagles and hawks and owls and things that we've worked on over the years and all sorts of stuff. So yeah, we're not strangers to birds.
No, their physiology is a lot different than your dog or cats or your mammals. And so, like Dr. Thibault was saying, they have air sacs. And so you have to be very careful when you go to ventilate that patient that you don't rupture those air sacs. And so their lungs are rigid and they're fixed. And so that way, what moves the air is their air sacs. And so you have to be very, very careful.
So let's shift a little bit and go back to the students. What advice would you give a student who is interested in pursuing a specialty?
The advice that I would give a student is, if you're thinking about a specialty or not, I would set yourself up to do an internship to at least set yourself up for doing a residency for that specialty, and make sure it's something that you're very passionate about, because that's what brings the excitement and the inspiration to the job. But with me, I did an internship so that way I could set myself up to do a residency if I wanted to, or I can just go right out into private practice. So I think really understanding what that specialty is and all that it entails would be my advice.
For me, when I have students talk to us about pursuing a specialty, I always advise them first that they just need to focus on getting through school and just trying to be as open-minded as they can about all the different aspects of veterinary medicine. Veterinary medicine is so much more besides, dogs and cats coming through the door. There's a lot of aspects to it. General practitioner work is vitally important, but there are just some people that want to do other things. And so when they're considering those avenues, I say focus on school, do what you can as far as your grades, and then just find an internship in some place that you like and that you want to spend at least a year figuring out how to be a doctor. And in that time period, if there is a specialty that you're truly chasing after, then that's when you can start focusing on those aspects of things. Some specialties nowadays, just because of availability, you might have to do a couple internships before you actually get into a residency program. And so you have to consider all of those aspects when you're thinking about it. And you have to balance that against the financial realities of what we deal with and the cost of veterinary education, and how long can you go by with very low salaries. I have no problem sharing my salary during my internship year. That was $24,000 during the year of my internship. That was over 10 years ago now, but still it was not a lot of money when you break it down on the hours that you put into that job. Residencies bump that up, but not much. And so it has come up even more since I finished my residency, which is good. But during that time period when you're making very low amounts of money, you still have student loans that are sitting there and there's interest that's accruing. So there's other aspects that I think people need to keep in mind when they're doing that. Can you commit to that? Is that something that you can handle, still having those? There'll be small student loan payments in that time period, but you'll have a little bit of student loan payment, but you're going to be extending the amount of time that you're carrying that debt load. And that's an important aspect of something that needs to be considered when anyone's considering furthering this out. Where if you just graduate from school and you find a good practice with good mentorship and you can start being a doctor and start earning money, then you can pay those debts off a lot sooner. So
I think another thing that's really important is finding somebody to mentor you through the process, because there's a lot of steps involved into specialty, going through an internship, then applying into a residency program, and then becoming a board certified specialist. So there's a lot of steps involved. So finding a really good mentor is very important.
Absolutely.
Thank you both for joining us today.
Thank you.
Thank you, of course.
Thank you for listening to Dogtors Without Borders. Be sure to follow us and stay tuned for our next episode.